Okay, we're looking, scanning the room. Nothing in the room here. Don't know what that is. Oh, good. It's Adrian.
Hello.
Carrie Sue, head to toe video. Okay. Hi, my name's Carrie Sue. I'm going to be your student nurse today. Can I have your name and date of birth?
Adrian Palacios, 11/12/03.
Perfect. Can I see your wristband?
Mhm.
Do you have any allergies I should know about?
Nope.
Okay, I'm gonna pull the curtain for privacy, and I'm gonna do some hand hygiene. Looks like doctor ordered a head to toe assessment today. Have you ever had that done?
Mm-hmm.
Okay. We're gonna do that again today. Have you any concerns about coming? Any concerns right now?
No.
Okay. Are you comfortable?
Mm-hmm.
Okay. So we'll get started. So I'll have to ask you about your family history, your demographics, your biological stuff, your reason for coming, and all of that stuff. And then we're gonna go straight to how did you get here today?
I drove.
Perfect. And where are we?
Douglas there.
Okay. And what are we doing?
Doing a head to toe assessment.
Okay. That's good. So your remote memory is intact. Or your remote memory is your birth date, so you know that your immediate memory. I'm gonna say three numbers. Can you repeat it back? 621.
621.
Now backwards.
126.
Okay, perfect. So you're alert and oriented. You have recent and immediate memory, so that's good. Have you had any like concussions or anything like that?
No.
No. Do you have any head pain?
No.
Okay. Do you have any history of like dizziness or stuff like that? Okay,
No.
perfect. And then so you don't have any like family history of like skin disease or anything like that?
No, just eczema.
Just eczema, okay. And no weird moles or anything like that I should know about before we start?
No.
Okay, perfect. I am gonna start, and if you did have any like weird moles, we would just want you to do like A, B, C, D, E. So asymmetry, so like symmetrical, and then border, it's got a weird border. If the color is kind of weird, if the diameter, if there's a weird diameter to it, or like evolving. So basically, if anything's changing with the lesion or mole, we would want you to let us know.
Okay.
Okay, and I did hand hygiene, and I'm gonna wear gloves just because I'm gonna be kind of touching and palpating, if that's okay. Okay, I'm gonna start with your head. So, feeling for pain, palpating. I don't feel any lumps or bumps. You look clean. I don't see anything in your scalp. Your hair is brown. It looks like you have good hygiene. You're dressed appropriately for the weather. So your neurological statuses are looking good there. And then I would check for any infestations, but I wouldn't tell you that. And then we'll just move on to your ears here. So when I fold or pull, do you have any pain with that?
No.
Okay, good. And then I go behind you. What ear can you hear this in?
Right.
This one?
Left.
Okay, and that's your acoustic nerve, so that's good. Okay, and then I'm gonna look in your ear. Do you have any ear pain? Do you have any tubes in your ears?
I used to when I was younger, but it was a temporary.
Okay, drainage in your ears?
No.
Okay. This one. Let's pull up and back. Okay, a little bit of earwax. Otherwise, good. No pain with that?
No.
That looks good too. Pearly white membrane. Pearly gray membrane. Everything looks intact. I don't see any redness or anything like that. Throw that away. And then we'll go on to your eyes. So your sclera is very white. Your eyelashes are good. There's nothing in them. I don't see any gunk. I don't see any lesions on your eyes. Can you hold on your eyes so I can look at your conjunctiva? Okay, so those are nice and pink and good. And your eyes are brown. Your pupils are symmetrical. And I don't see any lid lag or anything like that. Can you close your eyes? Do you have any pain when I touch here?
No.
Okay, and then while I'm here, like your sinuses, are there any pain in your sinuses here?
No.
Okay, good. All right, then we're going to do some tests with your eye. So if I hold this, can you see what this says?
Tongue blade, double sterile.
Okay, perfect. And do you wear eyeglasses or contacts?
Yeah, I'm wearing contacts currently.
Okay, do you have any glaucoma history in your family? Any like drainage recently from your eyes, anything like that?
No.
Okay. Any redness, itching? Nothing. Everything's good?
Mm-hmm.
Okay, and then so I'm gonna have you cover one eye, and then we'll check your peripheral. Okay, so you tell me when you see my finger.
No. Yep. Yep. Yep.
Okay, other eye. Okay.
Yep. 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 Yep.
Okay, and then can you follow my finger without moving your head? And we're looking for astigmatism, so like one eye kind of moving separately, so that's good. And then you follow my finger all the way in, and you follow all the way back there, over to the corner. Okay, it's like accommodation and the 6 cardinal gazes, so you were able to do that. You were able to follow my finger, and you were able to read. So then we're going to look at, where's my light? We're just going to use this. Okay, so I'll have you look straight ahead, and then we'll look at your pupil dilation. And again, and dilating at the same time. Okay, so pupil dilation looks good. No concerns there. So we checked your optic nerve, so number 2. Oh, and your hearing was number 8. And then we did so 6 cardinal gazes, accommodation. So optic is 2, ocular motor is 3, trochlear is 4, and 6 is obtusus. Okay, and now we're gonna check some trigeminal. Can you close your eyes for me and tell me where you feel this?
Left cheek. Forehead. Chin.
Okay, so that is intact, so that's great. And then can you smile? Oh, so trigeminal is number 5. Can you smile for me? Can you frown? Can you stick out your cheeks? Can you raise your eyebrows? Okay, so that's your facial nerve, so that's good. That's good and intact. And everything in your face looks symmetrical. Your nose looks symmetrical. Your eyes, your ears, all that's good. Can you, on one side of your nose, can you hold it and then breathe in? Okay, other side. So there's patency in your nose, and then I'm gonna use this again, and you kind of look in your nose. Can you look up and back? Okay, looks good there. And then I'm gonna look in your mouth. So I shall palpate your lower lip. Okay, that everything is nice pink. Your upper lip. Okay, everything looks pink. Mucus is good. No lumps or lesions that I can see. Can you open up and say ah? Okay, uvula is good. Gag reflex. Good. Look around. Teeth. Mucous membranes are nice and moist. Teeth are good. I don't see any cavities like that or anything going on. Do you have any like tooth pain or anything like that? And like when you swallow, do you have any pain?
Nope.
Have you had your tonsils taken out or anything like that? So all good there. Okay, let's go this way. And then I am going to check your lymphatic system. So I'm just going to palpate around here. So your post-auricular, pre-auricular, tonsillar, submandibular, submental. Then we have superficial cervical, deep cervical, posterior cervical, and supraclavicular. So any pain when I push around here? Okay, good. And then if you look up, okay, palpate the trachea, and no issues with your swallowing or anything like that. Trachea, and your thyroid, nothing there.
Nope.
Can you swallow for me? Okay, can you stick your tongue left to right? Okay, good. So we've covered 10. So the gag reflex. We have covered hypoglossal, and your hypoglossal is 12, your glossopharyngeal, which is 9. Because you can swallow and stick out your tongue and move it around, so that's good. And so we're gonna go to, can you shrug your shoulders? Oh, good. Okay, so that's your accessory nerve. Also your trapezius muscle there. And then can you push your head against me? Good. So your sternocleidomastoid muscle is good. And while I'm up here, might as well just check some pulses up here. So the temporal, that's good. And your carotid, we'll do one at a time. Okay, those are good. So we're gonna move on. And I think we'll do some more muscles. Can you put your arms out? Yeah, like a plane. This is your deltoid muscle. Can you push up? Okay, push down. Good. And then can you, like boxing fists? I'll say you can pull, okay, biceps, push, triceps. Let me see your hands. Okay, can you squeeze my fingers? Thank you. And then can you put them apart and don't let me move them? Good. Those are really strong. Can we roll up these sleeves? All right, let's check some brachial pulses. Those are good. 2 plus normal. Ooh.
Yeah.
Okay, thank you. All right, so we have radial and ulnar, and then while I'm here, I don't see any signs of pallor. You're a little bit pink, but we know that you have eczema. I don't see any edema in the arm. And then we'll check your capillary refill, which is right away, so less than 30 seconds, which is perfect. Okay, and then we'll go, we'll go down to your legs here, and we'll check edema there, and again, 0 to 2 rebounds immediately, which is grade 1. Grade 2 would be 2 to 4, and it would be up to 15 seconds, and then 3 would be 5 to 6, and that would be up to 30 seconds, and then the worst would be 8 millimeters, and that would be over 20 seconds. But I don't see any edema. And again, the skin is good. Do you have any pain in your legs?
No.
Okay, and there's I don't see any redness, no signs of DVT. And we'll do capillary refill in your toes. That looks good. And then while I'm down here, can you push up? Push down. Okay, so those muscles are good. Also, your pulses on the top of your feet, the dorsalis pedis. Those are good. And posterior tibial pulses. Okay, that's okay. Right, bring these down now. And your hair, good. I don't see any weird, like missing spots. Popliteal behind your knee. Okay. All right, and then I also do like your femoral pulses, which are right here. And then we can do some strength here. I did the feet. Let's do adduct. Can you push in? Abduct. Can you push out? That's great. And then can you pull? And that is your quad push. Good. So your pull, so your quads and hammies are good. This is your hamstring, and then quad is push out. Okay, and when I'm done here, I'll do a Babinski response. So I got this little hip here. And we'll go around your foot. Around. Your foot doesn't have any response, which is good. So that is normal. We would only see response usually in younger children. So that's all good there. Okay. I think since we're going to do muscle, can I just have you stand up?
Sure.
All right. So, and you don't have any weakness, dizziness, nothing like that. Okay, can you take a couple steps for me?
Sure.
Okay, your gait and stride looks good. All right. Can you stand on one foot? Okay, your balance is good. Can you turn around? Can I take a look at your back? Okay, can you bend over just a little bit? I'm just feeling your spine. I don't see any signs of scoliosis, which is the acid in your back. You need to stand up straight. No kyphosis, which is a humpback, nor lordosis, which is you pushing kind of out your stomach and a curvature there. So I don't see any of that. So that is great. Okay, and now we can move on to. Oh, and I had our CNA vital. So your O2 is 98%, which is good, between 94 and 98. So that's great. Your temp is 98.6, which is normal. And then your respiratory are 16, which is also normal. Your heart rate is 76. That's great. Your blood pressure. Your blood pressure was 120/80. That's like a perfect blood pressure. Okay, I'm gonna clean my stethoscope. And I'm just gonna listen around, and you're okay with that?
Mm-hmm.
Okay, let's do respiratory first. Have you had any COPD in the family?
No.
Have you had any respiratory infections lately?
Nope.
Any cough, any sputum? Nothing like that?
Nope.
Okay, and you don't see many signs of distress, like short of breath or anything like that? You're breathing normally. I don't see any signs of pallor, cyanosis, flu. I don't see any clubbing in the fingers. So those are all good signs. Okay. I'm going to listen.
Sure.
I just want you to take a deep breath every time, okay?
Mm-hmm.
Okay, now I go to your back. I have a listen. Okay. Okay. And I don't see or hear any signs of crackles or rails or stride or anything like that. You're breathing in and out perfectly. And when I'm back here, I am gonna palpate. Do you have any pain back here when I palpate around?
No.
Okay, and then I'm gonna check your excursion. Can you take another deep breath in for me? Okay, so those are symmetrical. I'm not worried about anything there. That was good. Can you also, we're gonna check tactile thermometers. Can you say 99?
99. 99.
Okay.
99.
All right. So good vibration. So I'm not worried about any lung collapse or anything. Symmetrical when you breathe in and out. Now we can go on to, let's go on to cardiac. We got that. So some cardiac questions. Have you already felt any like palpitations?
Nope.
Any heart disease in your family?
No.
Okay. I'm feeling like your heart's jumped out of your chest.
No.
No arrhythmias. You have you don't have any history of like AFib, so your heart just like beating irregularly, nothing like that. Okay. So I will listen to your heart. Yes, thank you for undoing that again.
Mm-hmm.
And I'm gonna start up at your neck with the bottle of my stethoscope. And can you turn your head and hold your breath? Good. Other side. Okay, that's good there. I don't hear any bruise or anything like that. So now we're gonna go second intercostal space here. We're gonna listen to our apical pulse. Oh, aortic. We're gonna listen to your aortic pulse here. And right over is pulmonic, and the left second intercostal space here. Sorry, I'm poking around. I hear it very well there. Now we're going to go to the third intercostal space is the Erb's point. The fourth is tricuspid. And then the fifth, the mitral. But this is your left side, right? No, it's not your left side. No, it's gotta be. Oh no, it's not. We're gonna start over there. Stick your card in again. Okay, we're gonna go second intercostal space on your right side, and that is your aortic. Okay, let's go down the right side. Okay, left side. Pulmonic. I mean, I can still hear it over there, so I mean, that's good. You have a strong heart. Third intercostal space, first point. Okay, now we got the fourth intercostal tricuspid. Here, I can hear it better there. And this is where we would hear, between the tricuspid and the mitral, we hear more of the S1 sounds. Sorry, I'm pushing up here. Now listen to it for a full minute here. Okay, I'll do 86. So that is well in range there. And then your S2 sound would be between your aortic and your pulmonic would be heard best there. Okay. And then if I palpate your precordium, do you have any pain here?
No.
Okay. And then when I was doing your apical pulse, something around here? No pain?
No.
Nothing like that? Okay. And then we can go on to abdominal. Can you lay back for me?
Mm-hmm.
I kind of want you semi-solid. Oh, I mean, falling off. Oh. That's right. There. Okay. And then can I bring your knees bent a little bit? Okay, on the inspection, I don't see any distension, no redness, no wounds, no masses, no bulges, anything like that. Have you had any problems with constipation?
No.
Okay, regular bowel movements?
Mm-hmm.
Do you have any pain in your belly?
No.
And nothing unusual going on?
No.
Okay, first I'm gonna auscultate them. And all quadrants here, make sure I get my sides right. Okay. So right upper quadrant, left upper quadrant, lower left quadrant, left lower quadrant. And I hear some good bowel sounds. I hear hypoactive or hyperactive sounds, and they're not missing. So that's good there. And then I'm gonna kind of just like push around. Any pain?
Nope.
I'm gonna push around here, nothing.
Nope.
I don't feel any bulges. So like can't push them too far, and then I'll percuss. So cupping my fingers, each quadrant. Alright, that all looks good there. You can go ahead and sit back up if you want, and hold on, we will listen to your vascular sounds with my bell. So the aortic, the renal, and the ileus. Down here. Okay, and I don't see. That's good. I don't see any scars or lumps or bumps or nothing like that. Okay, you can go ahead and sit back up. Let's see. Make sure I got all my. Oh, close your eyes again. Where do you feel this?
Left leg. Left foot. Is that right hand?
Okay, perfect. Your accessory nerves, all that you can feel. One more thing. I have you close your eyes here. What do you smell?
Alcohol.
Okay. Go ahead, you can open your eyes. So we have your olfactory nerve intact because you can smell. We did your accessory nerve earlier. Did all your muscles. Muscle, facial. I think we got all the nerves, and those all looked great. I'm just making sure I'm not forgetting anything here. Range of motion. Do you have any? You can do this comfortably. Any pain when you're doing that?
No.
And then I saw you walk. The range of motion was good. And then like any bony prominences. We don't have any pain in your like elbows, fingers,
no,
knees, nothing like that. Okay. That looks good. peripheral pulses. We got lymphatic. Oh, yeah, I'm gonna look for JVD. Can you turn to see if your jugular vein is distended? You turn that way. I'm just gonna take a look here. It's not popping out, so that's good. Other side. Okay. That looks good there. All right. I think we're doing okay. Do you have any concerns for me?
Nope.
Okay. I made sure your bed is lower than that. Your side wall is in a good place, which it is. There's something in the way. Here's the free table. Your call lights. I will document all my findings. I will remove my gloves. And I will do some hand hygiene. And thank you for letting me take care of